Okay, thanks for coming, everyone. So we are here to provide an update on Oregon's response to the vaping-related illnesses. I have here Dr. Dean Seidlinger. He is the new state health officer for Oregon. And we have Dr. Jennifer Vines, who is the new Multnomah County Health Officer. So,
not quite yet. In early 2020.
I'm sorry.
Still deputy.
Okay, got it. Thank you for that clarification. So they will start with a few words, and then we'll just open it up to questions, and just ask that everyone asks one question at a time, and let the questions go around the room before doing another question. So thank you very much.
Do you want our table mics on, or does everyone have mics up here?
I think we pretty much all have mics up there. But
Do we need it for the live stream? No? Okay. So thank you, everybody, for coming. Again, my name is Dean Seidlinger. I'm the state health officer in Oregon. Unfortunately, we're here to announce the tragic death of a second Oregonian from severe respiratory injury associated with vaping. This individual was one of the 5 cases we previously reported, so this brings our total death count to 2, and our thoughts go out to this individual's family and friends. We continue to work with our local public health partners, our healthcare providers across the state, as well as with our federal colleagues at the Centers for Disease Control and Prevention and the FDA, the Food and Drug Administration, on identifying a cause for this illness. The 5 individuals in Oregon were all adults. They all reported vaping a cannabis product, and they were all hospitalized, again, with the tragic death of 2 of them. This follows along with national trends where we've seen over 800 cases of severe respiratory injury associated with vaping, and 12 deaths nationally that were reported today. This does not include the additional death we're reporting today, which will be in next week's updated national count. So what we're here to do today is to urge individuals to stop vaping. The safety of this product has been in question for a long time. We know that this product is not safe, and we've seen health effects from this product. But with these acute respiratory injuries and deaths, we do urge all individuals to stop vaping, whether that's nicotine-based products, cannabis products, or other products. And people who haven't vaped shouldn't start. Switching to a combustible product like a cigarette is not a safe alternative. We know that nicotine and cannabis are addictive substances, and so there are resources out there with our Oregon Quit line, 1-800-QUIT-NOW, as well as the federal substance abuse hotline for those who are using cannabis or any other products who want assistance in quitting, and that number is 1-800-662-HELP. So we know that there's help out there. Talk to your providers. If you're vaping, nicotine, or one of the other addictive substances, please seek out help and please stop immediately. I'd like to turn it over to Dr. Vines to see if she has some additional comments.
Thank you. Again, I'm Dr. Jennifer Vines. I'm Deputy Health Officer for Multnomah County. We're working closely with the state to track this outbreak of vaping-related illnesses. We've already sent out a clinician alert to our Portland Metro email list of several hundred providers, echoing Dr. Seidlinger's statement around urging patients to quit vaping and asking clinicians to continue to watch for this severe disease and to report it so we can better understand what it is that's going on. I will add that the Multnomah County Commissioners, acting as the Board of Health earlier this week, issued a similar warning around vaping, and they've taken this issue very seriously, especially as it affects young people, as we also see the number of youth vaping skyrocketing. So they have turned their attention to nicotine, to flavored tobacco, and to vaping in general.
At this time, we're open for questions and providing answers.
When you talk about lung injury, what specifically is happening to people's lungs, and how are they dying?
So individuals all the individuals in this outbreak have reported vaping. They typically report with shortness of breath and trouble breathing, which progresses and gets worse. Individuals have then been hospitalized, many requiring intensive care and ventilator support because of respiratory failure that happens acutely. The exact mechanism of the injury we don't know, and the product or products that are causing this are still under investigation. And so it takes some time to collect the information from the individuals who've been ill, as well as some of the products they've been using that have been sent to federal labs for testing to really identify that root cause. But it is an acute respiratory failure that is underlying these individuals.
This latest victim, do we know, you may have said this when we started talking, is that male, female, do you have any kind of age?
The latest individual who died, like the other cases, was an adult and did report using cannabis products. I don't have any more information on the precise age or the gender at this time.
Do you know how long they have been vaping for? Do you have that?
This is an individual that had reported a history of vaping and vaping in the period prior to getting sick. And again, this case is one of the individuals we had reported earlier as being sick, and they unfortunately succumbed to their injuries.
From the first time that they got sick to when they passed away, how long was that period for both individuals?
I do not have that information. Sorry.
Do you have an average of how long these people have been sick for?
The range really does vary from some people presenting severely ill and having complications immediately to some with prolonged hospitalizations who recover, and others with prolonged hospitalizations who continue to get worse and succumb to their injury.
These two individuals that died here in our state, did they have other illnesses that could have contributed to their death? Underlying health issues?
It is thought that this acute respiratory injury that they had is associated with the vaping they had and not due to other underlying conditions that they had. I don't know if they had some other underlying conditions, but it is thought that the acute injury that brought them to the hospital and later caused their deaths is associated with the vaping products that they used.
Speaking of those products, you said they were cannabis products. Were these products that were licensed to be sold in the state of Oregon, or are these what are termed black market products?
For the products that were used by the people in Oregon were all from licensed retailers. That is not the case in all the cases across the nation, where there's been a mix of products that have come from licensed retailers as well as unlicensed retailers. But in Oregon, all of the folks who've been reported to have this injury have reported having licensed cannabis products.
You mentioned briefly the addiction part of it, and you mentioned a few phone numbers. Anything else the state can provide or information to people who are looking for, recovery and to get over this?
Right. I can say that nicotine is a highly addictive substance. So for those who are using vaping products with nicotine in it, either alone or in a combination with cannabis products, it can be a very difficult addiction to get over. Some folks who are using these vaping products with nicotine have switched from a combustible cigarette to what they consider a safer product, but that's not the case. We don't have the research on the safety long-term of these vaping products, and now unfortunately we know that there are these acute severe illnesses and even death associated with these products. So there is assistance. Talking to their medical provider is one good place to start, or calling the state quit line, 1-800-QUIT-NOW. They can get assistance not just with counseling, but with accessing FDA-approved nicotine replacement therapies that can help with the addiction and help to get them off the substance. At the same time, the federal substance abuse helpline can help individuals who are addicted to cannabis or want to quit using cannabis or other substances to find a provider and a program that can help them get off those substances, because these can be very difficult addictions to get off on their own. So we want to know that the healthcare community and the public health community has resources to help them, and these resources are covered by their insurance or available for free for those who do not have insurance.
For those individuals who are not frequent vapers but do vape occasionally, what's your message to them?
No level of vaping is safe. What we've seen in this epidemic is that we have individuals who are very naive to vaping, who've only started vaping for a short time and can have this illness. And we do not know the full long-term impacts of vaping. There have been reports of illnesses and health effects associated with vaping before this outbreak, we anticipate those will continue. And now with this outbreak, there's some folks with severe acute illness that's caused severe illness and even death. So no amount of vaping, even an occasional vapor, is safe. So that's why we're recommending that any individual who's vaping stops and they do not switch to a combustible product like a cigarette.
What's your worry right now going forward? You think we're gonna see more people hospitalized, maybe even more deaths?
I think as the trend continues, I think we are going to see increased number of cases and tragically more deaths. Part of that is we are really partnering with our local health partners and providers to report cases, but also since we do not know the cause, these products are still in the community and people could be using them, so we do anticipate we'll see more cases. And that's why we're trying to get the word out now and asking everyone to stop using these products immediately, because we don't know the short or long-term safety of these products, but we know they're not safe.
As far as the other individuals that became ill due to vaping, do we know what their status is right now? Because now there's 4 of them.
In Oregon, there have been 5 total cases of serious respiratory illness associated with vaping, and 2 of those individuals have died, with the other 3 individuals recovering.
Okay. And are they being hospitalized still, or?
I don't have the information on their care right now, sorry.
And I will just add, I don't know anything specific about people who recover, but the Centers for Disease Control is advising clinicians to do follow up on people after recovering, which suggests that there is a possibility of long-term lung damage and supportive care that people may need. Would you agree, Dr. Seidlinger?
Yes.
Yeah.
So we have a question on the phone, but someone's going to have to help us hear it.
Yeah, I can't.
Because I couldn't hear it, so maybe
It's really
Jonathan
muffled.
can help us. We have a question on the phone, but I can't hear it.
Just to repeat, we have 5 confirmed cases in Oregon. If we look at CDC data, they report confirmed and probable. My question is, in Oregon, how many probable cases are there?
We're not reporting our probable cases, just the confirmed cases, and that remains at 5 in Oregon.
Why aren't we reporting probable cases? I mean, if we're following CDC.
We have.
Can we?
Go ahead.
Well, I'm asking you to please to report the probable cases as well.
Yeah, I don't have the number of probable cases that we're working with our partners on. We're choosing to focus on the folks who we've done our investigation and determined that they meet the case definition for this, and report those confirmed cases to the broader community and to the CDC as well.
Okay. Hello.
Are there any additional questions or?
Another question on the phone?
Yeah, can you hear me? It's Christian Diesel at the Lund Report.
Yes.
Oh, you can hear? Okay, is Oregon going to consider banning vaping products? Banning the sale of vaping products?
Governor Kate Brown today issued a release and a directive to the Oregon Health Authority today after a report of the second death in Oregon to look at options we have for potentially decreasing the impact of this illness in the state. And certainly policy options such as a full ban on these products and other options are being evaluated right now. And Oregon Health Authority and Public Health, we look forward to providing those options to the governor and picking some solutions that we can implement to move forward together to protect the health of Oregonians.
Do you have a timeline for that?
The governor has asked for a return with some initial recommendations within a day, so we look forward to providing those recommendations in the next 24 hours.
Thank you.
Hi, this is Fedor Zarhan with the Oregonian again. I wanted to ask, so how many retail stores are now associated with illnesses?
I don't have the particular stores that are associated with these illnesses, just that all of these individuals reporting using cannabis products that were all obtained from licensed retailers.
Do you know how many licensed retailers sell vaping products?
I do not, but we can get you that information on the marijuana side. For cannabis, we can try and get that information for you.
Yeah, we're happy to connect you with the OLCC on that.
Okay, thanks.
Hi, were any of these cases outside of the Portland area?
Right now, we're not reporting on the geography of where these cases are, but they have come from various locations in Oregon.
We've been traveling here and I've been following along online the best that I can, so I hope I'm not repeating any questions that have been answered, but just a little bit more on the person who just died. When were they first hospitalized and how long were they hospitalized before they passed away?
I don't have the precise dates, but this is the individual who passed away, who we're reporting passed away today, has been one of the previously reported cases and has been sick over several weeks in the hospital and succumbed to her illness recently, and we're reporting that death today. So this is an individual who's been sick for several weeks.
And a woman?
I don't know the gender, sorry.
Oh, okay.
So you just referred to her as her,
Yeah.
so
I'm sorry, I don't know the gender of this individual, so if I did that, I apologize for that mistake.
Did this individual?
when did this person die?
The death was reported to us today.
Did this person have a history?
Does that mean the
of-
person died this week?
Fedor, could you hang on a sec? We have a question from the audience. Go ahead.
Oh, sorry, I didn't hear
Sorry.
that.
I was just gonna ask, did this person who died today have a history of lung-related illnesses, or are there other factors in this?
This is an individual who presented initially with acute respiratory distress and injury following vaping without another cause for that. So that's how they were classified as a case with this outbreak because another cause was not identified by the healthcare providers who were working this person up.
Go ahead, Fedor.
Oh, no, I'm good, thank you.
Okay. Any other questions?
Let's see.
Maybe one more question from.
This question might be a little more scientific, but people obviously smoke cigarettes, and we know it's not good for you. And they smoke pot too, and what really is the vaping versus the inhaling the smoke? Like, why are these illnesses, becoming so much more progressing so fast, I guess? It's hard for me to wrap my head around that, I guess.
So we've had a lot more history and information collected about combustible products like cigarettes, and know that there are high levels of carcinogens and other chemicals that are inhaled into the lungs and cause many of these health problems. With vaping, we know that there are acute effects on the body in terms of effects on the heart and the lungs immediately upon vaping. Some of this is due to the nicotine in those products that acts similar to the nicotine in cigarettes, but then there are other products that are in the vape that haven't been studied for their impacts on lungs, and we don't have long-term kind of historical information on people presenting with illnesses. So there definitely we know about some acute impacts on lung and health from these. We know from this outbreak that there are a severe form of lung injury that we're trying to identify the actual ingredient or part of the vaping product or ingredients that may be causing this, but we don't have all the information there, and it's an evolving field. And so, that's why we talk about cigarettes not being safe and vaping not being safe, because we are inhaling kind of foreign products into our lungs that have health impacts, and these have not been fully studied, but we know that they can be tragic.
Can you quickly just talk about the symptoms, like if people are out there and they're vaping, what are some of the symptoms they need to look for to go to a doctor?
We definitely want individuals who are having trouble breathing or shortness of breath and who have been vaping to contact their provider or go and see their provider immediately. Other individuals have reported some nausea and GI symptoms as well as other symptoms, but most of these individuals are presenting with acute kind of shortness of breath and trouble breathing, and it does follow their vaping.
Okay, thank you very much, everyone. We actually have to be out of the room in 10 minutes. Apologies for the tight window, but